I'm going to share with you information about our recent study, association between oral corticosteroid bursts and severe adverse events, a nationwide population-based cohort study. We conducted this study because corticosteroids are commonly used medicines around the world, including Taiwan, as 25% Taiwanese adults receive steroid bursts, defined as short courses of corticosteroid used for 14 days or less. Corticosteroids have been on the market for more than 70 years. Previous studies have well documented adverse effects of long-term corticosteroid use, for example, cataract, Cushing syndrome, cardiovascular diseases, and GI bleeding. However, the risks of steroid bursts are largely unknown. To address the issue, we conducted a nationwide population-based cohort study to quantify the risk of steroid bursts on 3 severe adverse events: GI bleeding, sepsis, and heart failure. We used the data derived from the entire National Insurance Research Database, comprised of approximately 24 million subjects residing in Taiwan, and deployed a self-controlled case series study design.
We defined the steroid pre-treatment period as 5 to 90 days before initiation of a steroid burst. 2 post-treatment periods were included, 5 to 30 days and 31 to 90 days. We then compared the risks in the pre-treatment period to the 2 post-treatment periods using a modified self-controlled case series design. A 4-day washout period pre- and post-steroid initiation was included so that adverse events during that time were not included. A total of 2.6 million subjects were prescribed a single steroid burst. The most common reasons for prescribing steroids were skin disorders and respiratory tract infections. The incidence rates of GI bleeding, sepsis, and heart failure among subjects prescribed steroid bursts were higher than in non-steroid users. The highest risks were observed within the first month following receipt of the steroid burst, with an incidence rate ratio of 1.8 for GI bleeding, 2.0 for sepsis, and 2.4 for heart failure. This risk was attenuated during the subsequent 31 to 90 days.
Hello everyone. The findings from this national longitudinal cohort of 16 million Taiwanese adults are consistent with the findings reported in the longitudinal analysis of 1.5 million US adults. In that study by Hui-Ju et al., 21% US adults received short-term oral corticosteroid use, defined as less than 30 days duration of steroid use over the 3-year period. The most common indication for steroid use is upper respiratory infections in their study. In summary, our study demonstrates that steroid burst can lead to an increased risk of GI bleeding, sepsis, and heart failure within the first month after steroid initiation. Therefore, we suggest physicians who consider prescribing steroid bursts to their patients should weigh the benefit against the potential risk of this severe adverse event. Furthermore, after initiating patients on oral steroid burst, physicians could be on the lookout for this potential severe adverse event, particularly within the first month. We thank you for your attention.